Hello, I'm Janice Lushore, and I'm going to talk to you today about suicide prevention in children, adolescents, and young adults. In young adults, suicide has increased over the years, according to the Australian and New Zealand Journal of Psychiatry. The risk factors for suicide in this group are leaving or dropping out of school, parental divorce, that's mostly with males, stress due to problems with family, and that's mostly females. There's stressful issues with friends, relationships failing, with relationships failing, or with high alcohol use, or previous diagnosis of depression. Know the signs and symptoms to prevent suicide, such as social connectedness. The Gary Lee Smith Suicide Prevention Program is a program that is useful in preventing suicide by having different programs, different interactions for this age group. It has shown reductions in both attempts at suicide and deaths in this age group. Moving on to children as young as 8 years old, believe it or not, are committing suicide or attempted suicide. In most cases, this is due to bullying, whether it's in person, like at school or in the neighborhood, or even social media. Children in this age group often become withdrawn. They don't want to go to school. They display anger outside of their norm. Suicide is the second most common cause of death among this age group. It is important to know the risk factors and be ready to support your child. Ways to prevent it is to continue being supportive, have non-judgmental lines of communication open. Get them help if you even think they're thinking about committing suicide. You can also ask your child's pediatrician for referrals or connections to mental health professionals. Moving on to adolescence. This is a time of change when young people deal with stress from many different directions, such as relationships with friends and family and problems at school. Many adolescents admit to thinking about suicide at least once. In 2014, suicide was the second leading cause of death among young people ages 13 to 19 years of age. Suicide prevention for this age group includes knowing the risk factors such as alcohol or drug use, depression, feelings of social isolation, and difficulties in life such as poverty, abuse, and bullying. Be supportive and proactive. If you see or think you see signs and symptoms suggesting suicide or the possibility of suicide, seek help immediately. If you see something, say something. The problem with suicide and the reason that suicide has been kind of increasing at times is because people don't say anything. People think that the people who commit suicide, they're just being dramatic. They're just saying something. They just want attention. Sometimes that's not the case. The people that you think are the strongest are the people that you need to look out for the most. If you see something, say something.